As major cities go into lockdown and hotspots pop up around the country, it feels like a Groundhog Day for many, and it's taking its toll.
My mother is in palliative care I don't want to get emotional, in Melbourne, and there's one thing I wanted to do, was to be there and hold her hand, and I'm not going to get that chance.
For Sydney-based hairdresser Kathy Gilbert, the pain of not being able to visit her dying mother is being compounded by the news a staff member at her salon tested positive to COVID last week.
Yeah, we had to close the salon and go into quarantine.
The person who tested positive I've had contact with, and I am really concerned about their well-being, because I can't imagine how scary that would be.
Like many Australians, Kathy feels she's living in limbo.
The hardest thing is just all living with the unknown.
It's that feeling of the unknown and uncertainty about the future that mental health experts say is being felt right across the country.
We can't keep going through these lockdowns. I think people are totally over it.
Is everyone a little bit fragile, do you think, after the past year?
Yeah, look, I think people are pretty tired. Most people have had a loss of well-being and morale.
Professor Patrick McGorry leads youth mental health facility Origin in Melbourne, and he says the cumulative effects of the pandemic, lockdowns and fluctuating restrictions over the past year are also having more serious consequences.
The temperature has risen in terms of anxiety, and that means that a proportion of people will tip over into need for care. We've seen a surge of demand.
Data given exclusively to 730 shows 83% of psychologists surveyed around Australia reported an increase in clients' levels of anxiety, depression and distress during last year's lockdowns. The Australian Association of Psychologists expects those figures to increase during the current lockdowns.
I just was discharged from a treatment facility for my eating disorder, anorexia, so I'm trying to transition back into normal life, really.
22-year-old Bridget is taking recovery one step at a time.
I am diagnosed with borderline personality disorder, but then I've got like the depression and anxiety as well as OCD and anorexia. I think for people who don't understand what it's like to go through, just imagine trying to be held underwater with like a brick tied to your leg. You're trying to get out and try and breathe, but then you can't.
Bridget says the pandemic restrictions added to the mental health issues.
I was in a very stable space with my mental health conditions, including my eating disorder. And then when COVID came, my anorexia decided to come back strong, and then I relapsed in self-harm as well. I think for me, it was the loss of sense of control that I thought I had.
The national eating disorder charity, the Butterfly Foundation, reported a 116% increase in demand for its online helpline services last year.
Why do lockdowns have such adverse effects on mental health?
The impact on social connectedness, social cohesion, that's one thing. The economic effects, they sap the joy out of life.
Professor McGorry says younger Australians seem to be bearing the brunt.
The surveys that we've done at Headspace have shown that 75% of Australia's young people describe their mental health as worse under COVID.
730's also obtained a confidential Victorian government report which shows a spike in the number of young people seeking emergency medical help for mental health conditions during and following lockdowns. Victoria spent more of the past year under lockdown than any other state. Beyond Blue reported a 39% increase in calls during the first days of Victoria's most recent lockdown.
The mental health system is a weak point in Australia's generally good health system.
In March, a Royal Commission found Victoria's mental health system was failing. It made 65 recommendations, which the Victorian government committed to implementing, with a new tax to help fund them. Now, one of its commissioners, Professor ALLAN, FELS, is calling on the other states to do more to stem a tide of mental health problems.
I'd like to see other states follow roughly the outline of reforms that Victoria came up with. I suppose there are two sides. One is lockdown really does have bad mental health effects. I suppose if you don't lock down and COVID spreads, that also causes anxiety.
Bridget is beginning the long process of recovery.
I'm looking forward to going back to study, going back to work, going back to having a social life. Well, that's if COVID allows it. I'm just looking forward to living a life and fulfilling my dreams.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.